Hello, this is Dr. Peter Lind. The 30-page recovery report is chock full of information. There are 5 major points I'd like you to pay particular attention to. One of them, the first on the list, is anemia. Now you're going to read about anemia, and that means not carrying oxygen in the blood. Your body can't heal without oxygen, so that's the first real important step we need to find out if you have it or not, and you don't know until it's tested. So we're going to run a blood test on your iron markers, your ferritin levels, your red blood cells, and we're going to see what happens to your anemic state. We're also going to test your tissue perfusion of oxygen, and we do that in the office here. So that's the first step. The other step, or the other point, is going to be blood sugar. Now, if you're insulin resistance or hypoglycemia, do you know that there's no medical care for this except candy bars? I mean, come on, we've got to get our blood sugar balanced. And if it's not balanced, your body's going to whipsaw back and forth to hyper and hypoglycemia. Your brain isn't getting the correct amount of glucose, and your body is not as well, you can't heal. So that's the next thing we're going to look at. Fatty acid metabolism, like cholesterol and LDLs and triglycerides. Listen, that's big talk today, but you've got to get these under control, and it's not done through medication. Boy, look at the side effects of Lipitor and some of these other medications. It's like crazy. You've got to get this under control naturally. And, you know, looking at fatty acids, it's really closely tied to blood sugar. So if your blood sugars levels are off, your fatty acids are going to be off. Liver and digestion is the other one. I'll tell you right off, if you have digestion problems, you cannot heal. So that's a major first point we're going to look at, is your digestive system, including liver and gallbladder. Well, the next one is immunity. And I'll tell you what, that's going to be huge. And we're seeing more and more people with immune problems that are wrecking their whole system. And it's being missed all the time. So we're going to look at specific tests to find out what your immunity is, and helping your immune system, which is connected to your endocrine system or hormonal system and neurological system. Boy, everything's so tightly controlled and regulated. But when one side goes, it pulls the rest of them with it. It's like a big web of your body's metabolism. So we want to find out what the priorities are in your system, and that's what this report is about. I hope you enjoy it, and I look forward to speaking with you soon.